The way to effectively engage patients, certainly in primary care, is to first start by acknowledging the primacy of their role in healthcare. It seems obvious, right? There are end users. They're the people who we signed up to serve and to promote their health and to take care of them. But so often we've spent so much time designing and redesigning our systems around what we think is best, or what we think the pitfalls are, or what we think the best things should be, almost as if we know best. But the first part of engaging patients is actually to say, or to ask them, what is your take on things? What's working for you? What's not working for you? To have that level of confidence and trust between you and the patient to say, I'm open to your feedback and I'm not afraid to receive it, but also to have that level of respect to them, to say that, I actually don't know the best answer to reorganizing this part of my practice, but I bet that you might, and I'm going to have the confidence to ask you. And when we've done that, we get amazing answers. We get answers about ideas and problems that we never might have seen or imagined. And more importantly, or as importantly, we get answers around processes for which we thought we could redesign ourselves better, but in fact, they help us to avoid pitfalls or traps and thereby improve care faster and better. We have an improvement collaborative in Boston in which we've engaged 19 practices from 6 academic medical centers in a journey towards team-based care, towards more patient-centered care. And we've seen amazing examples of the power and value of engaging patients. There's an example in one of our larger practices that had never had teams before. They had suites where practitioners would nominally sit together and practice, but they hadn't actually functioned as units of teams, units of identified individuals that met regularly, that huddled around visits, that huddled around population metrics. And so as the practice was reorganizing itself, they realized that the patients weren't quite understanding what it is that they were doing. And it wasn't until a patient actually made the suggestion, and this is simple but powerful, and said, I heard you wanted to organize around teams. Perhaps you should put signage around where each team is and identify them with the team name or color so that I know where I'm supposed to be and I can identify team members with that color on the lapel. It sounds so obvious, but in doing that and in getting the signage, the patients actually get invested in being taken care of as a team. They're not worried about losing their provider. What they see is augmentation, and that's exciting. Another powerful example is actually involving patients in the improvement teams. We have a whole network of clinics in our collaborative in which the patients are not just asked for their comments or fill out surveys, they're actually invited into the practice, into the improvement team that's tasked with improving the practice and promoting team-based care. The books are opened and the patients are there as meaningful members of that improvement team, helping to guide the journey, helping to keep the team afar from rocky shoals where they might founder because they know that idea, while well-intentioned, is probably not going to work because at the end, they're the users, they're the consumers. And we've seen an incredible explosion in both efficiency of improvement and experience of improvement in those clinics that have brought the patients into the teams with them. And that's been really exciting to see. Some clinics decide that it's a staged process. So by that I mean they'll say, we want meaningful patient interaction, but we want to figure out with our patients what that means. So they'll start a patient and family advisory council. There are fantastic resources on the web through IHI, through other organizations about what are the concrete steps that are involved in starting a patient family advisory council, how to have enough patients, how to find the right patients, the right mix, how to meet, when to meet, what agendas to set. That can be the entree point to get, in particular, the staff, the providers, comfortable, routinized, understanding of the power of patients and their feedback, and then they can take the next step. Other practices, and there are improvement guides that exist for this, say, we don't need to take a staged approach. We know where we want to go, which is having patients involved meaningfully in the work as soon as possible, and we'll end up going there by going there quickly. And so they bring the patients through a process of selection and sort of moving through the sort of volunteer apparatus of the organization, and quickly pull them onto the team, get them up to speed on the team's work, and make sure that there's not just one patient, but that there are actually a couple of patients who bring varied perspectives, and then basically throw them in and get everyone used to dealing with sort of the end user. And providers sometimes are scared about that, but we've rarely found that it's a problematic process, and we've found almost always that the practices that have just almost like jumping into a cold swimming pool, if you just do it quickly but thoughtfully, that you can get to where you want.